So my name is Kayla Major, and the topic I picked for my public health issue is HIV. What is HIV? HIV stands for human immunodeficiency virus, which is a virus that attacks the body's immune system and weakens the body's ability to fight infections and can also lead to AIDS if untreated. So since HIV is an uncurable disease, that means you will have it for life. Currently, right now, there are 38 million people worldwide that are living with HIV, and there were 1.5 million new cases diagnosed just in 2020 alone. And if you look to your right-hand side, there is a chart showing a map of the United States. And as you can see, the darker the color means that there is a higher rate of HIV diagnoses within the population in those states. So the highest three would be Louisiana, Georgia, and Florida. And as you can see, California is kind of in that middle color. So HIV risk factors and transmission. HIV can be transmitted through use of non-sterile syringes and tools, through breastfeeding, pregnancy, blood transfusion, organ transplant, and unprotected sex. But HIV cannot be transmitted through eating or drinking off of someone else's plate or off of their drink. You cannot get it from insect bites, from kissing or touching or toilets, and also you cannot get it from clothes. And after 2 to 4 weeks of being infected with HIV, you will begin to have what is known as acute HIV infection. And that is basically going to be flu-like symptoms that somebody will get when they are first diagnosed with HIV, which can include muscle aches, chills, mouth ulcers, fever, sore throat, fatigue, night sweats, swollen lymph nodes, and skin rashes. So these are things to be aware of if you have unprotected sex with someone. If you start to experience these after 2 to 4 weeks, you might want to consult with a doctor or get tested. So the consequences of HIV to AIDS and prevention. So after you have HIV for up to 8 to 10 years, and if it's untreated, you can end up having AIDS. And this can be prevented with proper antiviral treatment. So AIDS is basically when your T cell count is below 200, then you would be diagnosed with AIDS. And since HIV is something that weakens your immune system, when you have HIV, you will become more prone to being seriously ill from infections such as the flu, and COVID-19 would be two popular ones that we are most likely aware of. And as everyone knows, COVID has been a very big thing that has been going around. And even though it is starting to slow down, people who have HIV, if they are diagnosed with COVID, this would make them in the high risk category. So when you think about HIV, you should take some time to consider some of the main prevention methods, such as condom usage, PrEP, and PEP before having unprotected sex. So PrEP is something that you would take a daily pill every day if you are HIV negative. And PEP is something that you will take after you're exposed to HIV. It needs to be taken immediately after in order to avoid contracting the disease. And if you practice safe sex and keeping up with your doctor's visits, you can too prevent HIV. Thank you.